Good afternoon. And today we're gonna celebrate the anniversary 2 years since I got an idea of having this channel. And I'm gonna share with you uh, lessons what I learned from this experience. So first of all, I would like to express a big thank you to the TED community and particularly business coach Alisa Kohn, Jenny Blake. I got a lot of ideas from their podcast and Brittany Sarah Murphy as well. I think this time of our evolution, this oral way of transferring the information is really convenient. So if you someone who have a trouble sleeping or sleep next to the snoring partner, maybe today program not going to be so much for you. But if you're a medical professional who just like me wants to have a message heard, I think this program can really introduce you to my journey and maybe some of the steps of what I learned based on PubMed articles, my personal experience, interviews I conduct with the different medical professionals can be useful. Every night, millions of people lay down to rest, and 20% of the population experience sleep and breathing disorder, which can go from snoring to interrupted breathing. And as a dental professional who see a lot of problems in a very close proximity, we're talking about broken teeth and restoration, crowding, crowded airway, I see it so vividly. And also, somebody who like to connect the dots, I notice how those signs are really reflected on a general health. I witness a lot of problems over the interaction with patients over 20 years, how slowly but surely they develop high blood pressure, diabetes, atrial fibrillation, pain in a different part of body, muscle pain or pain in the spine. And I was always wonder about this mouth and body systemic connection. But I was always shocked by the fact that 87% of those people undiagnosed or untreated. And I was wondering why. In trying to connect those dots, I noticed that there is a huge gap between seeing and diagnosing the disease or having idea about the disease and actually helping patients to get. I was always surprised by that disconnect. The fact that dentists and hygienists and myofunctional therapists, sleep and language pathologists, and all other practitioners, physical therapists, spend countless hours trying to educate the patients that message it's not being heard in the same way by the broader medical community. I was wondering, maybe we don't speak the same language. When we have information or access to information right on our fingertips, how come the message not being heard? It's like I'm trying to deliver beautiful speech in Russian, but you don't understand. Maybe that fact, what we have to really change our language a little bit. And that question I constantly ask during my interviews. And regarding our area, I noticed that most of the people get the advice from family and friends, and then they support the information they find online. And after that, they make a healthcare decision or solution related to sleep and breathing disorders. And I'm going to tell you very common story. I'm sure you have the same stories in your practice. So this is my patient, John. And during the years of professional interaction, I noticed, he complained about restless nights and stop breathing and gasping for air. So I raised the awareness about the sleep apnea and I sent him to his medical provider. And, I would like a medical provider to do the sleep study and get the referral for oral appliance. But what I noticed, what he didn't get, he left the office almost without the information and with a little help on that topic. And as John's story unfolded over the years, I think the main reason was really dividing on a department in medicine what's responsible for overall health, and they don't have a good integration. And people like John, and I'm sure a lot of people in your practice, suffer the same way. So my goal for this program today to deliver you 10 lessons of what I learned on my channel from the interviews, and how to bridge that gap between medicine and dentistry, between the patients who need help and how they receive help. So this is the 10 lessons. I'm not going to read them, but I'm going to go over each lesson separately. But at this moment, I would like to express my appreciation to all the people who participate in my channel, all medical professionals, physical therapists, sleep technologists, people who talk about weight loss, primary care physicians, and nutrition, also my functional therapist and speech and language pathologist. So because of you, I put this wisdom together. So this is my first lesson. I like to call it headless horseman approach. And I want to tell you the story. My virtual friend, Dr. Anna Morze, interviewed wonderful physician, Dr. Atul Malhotra, on a World Sleep Congress 2023. And one of her questions was about treatment for obstructive sleep apnea with oral appliance. And that's what he expressed. He said, dentists always try to sell things. He said it very officially and without significant scientific proof. And if pulmonologist send the patient to the dentist, he might never see the patient again. And also, she asked him a question about myofunctional therapy. And she said, yes, there are anecdotal support to that way of treatment, but it's not enough for now to embrace it as official treatment strategy. Yes, it sounds all negative, but I actually thank Dr. Morze and Dr. Malhotra for bringing this negativity, because it helps us to illuminate certain point of this disconnection. In his interview, he pointed out what lack of standards and lack of proof on before and after results. I'm talking about before and after a sleep study, what can create value for medical doctor like Dr. Malhotra, and also standardized measurements of the effectiveness of myofunctional therapy, like the language he wants to know before he send the patient. And I start doing a little bit deeper research. And that's what I learned, what separation between medicine and dentistry happened in 1930, last century. They separate medical and dental school. It used to be together, but now, based on difference in the medical school, insurance system formed, dentistry being as a preventative, and then, the rest of it is a medical insurance. And we, as a dentist, and I had a wonderful conversation about that with Dr. Fernanda Almeida on my channel. She talked about the fact that we're not part of electronic medical system, and that's why it takes a lot of time and it's very expensive to obtain sleep study and referral for oral appliance therapy in this specific way to be able to submit to insurance to do the therapy. And I know for us, for dentists, it sounds really, sign of pride, what we are fee for service. And very often we mention that to the physicians, but it doesn't sound good to the medical doctors. They actually don't want to hear that. They want us to understand their point of view. They trying to make the treatment affordable to the patient. And I think it's a significant success if we change our mentality and would present it in such a way to the medical community about our treatment and fight for being included into electronic medical record system. The second lesson I find very powerful. I want to understand what doctor want from the provider he referred to. And I search a lot of PubMed article, and 87% of the physician put credibility in a medical skill. But I'm gonna bring back the same topic. They want us to speak their language. We're talking about HI and before and after, and we're talking about Epworth and fatigue questionnaire. They want to see the proven results, and maybe in the shape of article in scientific magazines. I think that would increase the credibility for medical doctors to refer. And then 50% of them express the important topic called insurance coverage. It's especially affected the female physicians. They're very conscientious about the service being covered by insurance. And then, the 50% also mentioned about timelessness. They want ability to make an appointment to be easy and fast for the patient. And then also significant factor, I would say 45%, is interaction factor. They want to make sure if we can return patient back to the physician. Sometimes it may be very difficult, but at least they want to be informed about different steps patient going through on a journey through the letters. So it's very important factor to keep medical doctors in a loop. And the letters have to be written again in their language, maybe not so much about range of motions and things like that, but the metric, what they understand. And now, how can we find that physician and create a relationship with him? I was reading that great book by Jason Tierney called Transforming Dental Sleep Medicine, and he talks step by step about very important topic called medical initiative. He explained what you have to do to create those relationships. And of course, I did it over and over again. And I spoke to a lot of my colleagues. And yes, I felt the same way as a used card sales person. And this is my famous story. I studied the physicians before I established initiate the contact. And it was a physician in my area, highly respected. And I know he was really into great food. So we communicate, and he expressed the desire to go to this certain restaurant for dinner. And I arranged all of that. And I was fully equipped with the articles, with the oral appliance, with my own cases. And I thought I did a great presentation over dinner for him. And, we had a great connection. And when I paid the bill, he said to me, really powerful phrase. It was pivotal for creating this channel. He said to me, I'm not going to refer to you. He did not have a trust. But just like you notice, I like to embrace all negativity and make something positive out of that. What I learned from that, if I want to connect with someone, it would be wonderful if somebody who that medical provider trust can introduce me to the provider. It's not always the case, but if it happened, that significantly increase your chances of winning the trust. And after that, it's true. You have to continue polish the relationship and remind about yourself. But then relationship can grow on a good foundation. And yes, it's true. It's hard to deliver message to medical community, but we have a great chance to deliver message to our patients. But how we should pack the message to have message heard. A lot of things change in a marketing vehicle. And this question arises in my practice quite often. I find what traditional marketing with the postcards, with the big billboards, very expensive TV advertising doesn't work. And I went through a lot of PubMed articles, and going to the big healthcare. So what I learned, what even the huge corporations significantly decrease allocation of the expense to TV advertisement, and eventually it's going to be none. It's going to be gone. And what I learned, what 80% of the patients use their smartphone to get the information. So your presence, you have to be present there for them to find you and learn about you. Another wonderful thing I learned, what you have to have authentic online presence in the healthcare. It was a survey with 4,000 physicians in the social media. So from 4,000 people, 90% said what they use social media for their personal reason. That's the way to get a physician. And 65% use social media for professional purposes. And by being online in 2 years, interacting with a different influencer, and some of them are medical doctors, they also use the platform to deliver their messages online. And you don't have to dance on a TikTok to deliver your message. There are different platforms for different purposes, like Instagram and Facebook would be for social interaction. And if you want to deliver the message, then it would be video on the YouTube. If you want to deliver the information, it would be Wikipedia. And I just want to mention, it's really powerful what 3 billion people on the Facebook right now and 2 billion videos on the YouTube. It's not gonna disappear. We have to embrace, but your message have to be you. It have to be authentic and reflect you. I know a lot of companies approach me with the cookie cutter website, and I have to politely decline, just like a TV interview, because it's not gonna show patients who I am and what atmosphere they can experience when they come to me for care. And I just want to give this very powerful statistic, what 45% of the patients use social media when they find the doctor for second opinion. And 41% use social media to choose the facility they're going to have a medical care or selecting the specific doctor. So social media impact is huge. Another striking fact I learned by interviewing the patients on my channel, as well as from the scientific articles. After COVID-19 pandemic, we all experienced more or less telehealth because we were isolated. But after COVID-19 pandemic, 66% of physicians find telehealth less convenient for them. But 60% of the patients, they said it's more convenient for them than than coming to the office, and they planning to use the convenience of telehealth. So we just have to embrace. And for the interaction or initial consultation for patients in the comfort of their own home, I find really comforting for the patients. And I use that vehicle on our initial introduction with the patient. Wearable technologies, being in communication and interviewing some influencers, I learned what wearable technology is here to stay. I had an interview with Molly Eastman, who had a program online teaching people how to sleep, called Sleep as a Skill. She used Aura Ring to make patient accountable for their choices, and also delivering breathing technique through breathing trainers, through the Bluetooth, and circadian rhythm training. She used a lot of wearable technology to bring the message to the patient. And I find what some patients in my practice, like let's call him Sean, he used his Aura Ring to make himself accountable for lifestyle choices. And I brought that strategy to my practice, and I highly recommend it to other sleep apnea dentists and myofunctional therapists when they incorporate the exercise and oral habits and breathing pattern to use to show how that can affect impact the sleep using the technology, wearable technology, and that's gonna decrease interest and involvement in the treatment journey. Another moment what I learned from my patients, what they want the provider to be on top of the innovations. But how would you explain to patients exactly what this or that innovation gonna do for the patient? I use it in the shape of the interview. For example, I'm very passionate about treatment sleep apnea in conjunction with oral appliance device plus clear aligners therapy. So I interview the inventor of the Oasis, Dr. Mark Abramson, and owner of Sleep Architect, another dental lab company who made appliances over the clear aligners. And I put interview on my channel. Then I also put a lot of interviews, but specific interviews with my patients who had myofunctional therapy or who had oral appliance in a particular way. I asked them the questions that I usually get from other patients, like law of the improv. People are interested in the small details, and that help my patients to make a decision if treatment is for them or what particular treatment they want to choose, what treatment strategy would be suitable for them, what they can learn from in the comfort of their own home, listening to the other people. And once we're talking about credibility in the same language, I interview a lot of authors on my channel. They were doctors and my functional therapists. And they put their message in a book, and I highly encourage, because that's the language what medical doctors understand, as well as I encourage medical professionals to write the articles. And over the 2023, I had a lot of interaction, and I have a lot of appreciation from medical editors who helped me to shape my articles, especially to Dr. Masse, who start that journey. So in 2023, I published 4 articles on the topic of obstructive sleep apnea and myofunctional therapy, and as well as public speaking. And I'm very passionate. I was on the board of TEDx. I think that platform, speaking to the general public, will help us to deliver our message, to have our message heard. And as I always say, books crystallize wisdom. And by doing so, we can put our message in a very deliverable container. But most important lesson what I learned by interviewing those medical professionals, what we need to create the community, and it can be a community in real life or virtual community, in that active participations in the other people community, people who deliver the similar message significantly help. Because by the way, if you want to publish the book, publisher, it would be the first thing they're gonna learn about your online presence and about the community and how your message resonates with the other people. But in the same time, community is such a great way to have your message delivered by supporting each other, because the only way through the community we can create patient-centered, holistic treatment what's gonna benefit our patients. Now, I want to tell you about John. I witnessed over the years his fight with the obstructive sleep apnea and insurances, and I witnessed how he was from 1 medication for high blood pressure to 2, 3, and 4 due to the sleep apnea. And then on top of it, he developed AFib, and I witnessed him to go through 3 ablations, and the cardiologist did not really emphasize importance of sleep apnea treatment after the first and second procedure. But then after the third procedure, I helped him with oral appliance therapy, and I published article in the Sleep Lab magazine. Thank you to Michael Di Domenica and editor Robin. They helped me to shape that article, and I was able to tell about our journey. So thank you very much for listening. Your support of my community significantly plays significant role in my life. Thank you very much. And by doing so, by doing this interview, it helped me to become much better clinicians. A lot of people opened my eyes on many different connections and topics. So I grew significantly as a clinician in the last 2 years. So thank you very much for listening.